Hello and welcome to Wellness Live. My name is Dr. Olivia Moses and I will be your host today. This broadcast is brought to you by Living Whole. That is the Department of Corporate Wellness here at Loma Linda University Health. Well, thank you so much for joining us. We have a wonderful session for you today. And here at Loma Linda, we truly believe nutrition, or what we eat, has a direct and profound effect on our health and how we feel. So, have you heard that nuts are good for you? You might have, because it's been all over the news over the last several years. And we have a wonderful guest speaker for you today. I have a lot of accolades for her, but the most important one to me is she was one of my nutrition professors, one of the wonderful nutrition professors and very knowledgeable that I had during my training here at Loma Linda as well. This is Dr. Sujatha Rajaram, and she is a professor at the School of Public Health here at Loma Linda University. In addition, she is the director of all doctoral programs for the school. So we have a wonderful guest speaker for you today to talk about the subject of nuts and how does it help our health and how it helps our longevity. So without further ado, I'd like to introduce you to Dr. Sujatha Rajaram.
Thank you so much, Dr. Moses. It's really a privilege and an honor for me to share from this Wellness Live platform. And today I'm going to be talking about going nuts about healthy aging. And there is a reason for that title. And I have had the privilege of being at Loma Linda for 25 plus years now. And it's been an honor working with a group of researchers at the School of Public Health that are all passionate about various plant foods, especially nuts, and how nuts can be part of a healthy diet to help reduce the risk of chronic diseases, but also help with healthy aging. So over the last 25 years plus, I have been part of this research team. So today in my presentation, I'm hoping to share some of our experiences, what we have learned, and also what others around the globe, researchers that have contributed to the evidence base in this area. And I'm going to share my presentation here so then I can talk a little bit. So let me get to sharing my screen. Okay, so nuts about healthy aging, right? So what I want to cover today is go through a little bit about the health and wellness and the statistics about why are we concerned about the prevalence of the various chronic diseases as one grows older. And then we'll dive into the world of nuts to discover what are the various nuts and what is it about the nuts that's good for us? What does these nuts contain that is good for us? And then I will share in the second segment of what my presentation, the actual evidence base for the role of nuts in healthy aging. And finally, I'll conclude with some practical recommendations that we can implement going out of this talk today. So the United States Census Bureau has told that this United States is now called an aging nation. And the reason for that is the population that is 65 and older is on the grow. And if you notice in the statistics that you see here, in 2016, that 65 and older adults in the US were about 49 million. And by 2034, that is projected to go up to 77 million. And by 2060, to close to 96 million. Now, that is a tremendous growth in the aging population, not a steady increase, right? And the thing about this is, for those of us that might be in that category in the next 10, 20 years, that is a good news because we are saying, oh, great, we are going to live longer and it's going to be great. However, along with the statistics, what we notice is that the prevalence of some common chronic condition is also on the rise. In fact, in adults that are 65 and older, 1 out of 5, that is 80%, have at least one chronic condition, and 68% have about 2 or more chronic conditions. And the common ones that we see among this group is hypertension, high cholesterol, arthritis, heart disease, diabetes, Alzheimer's, dementia, and a variety of other things. So while the quantity of life is growing up and we are living longer, so is the quality of life is not quite where we would like it to be. There are still a lot of chronic diseases. Now, many of these chronic diseases are also called lifestyle diseases because many of the choices we make with our lifestyle habits, including the food we eat, whether we exercise or not, whether we have other habits like smoking, alcohol, or whether we can sleep better, are we sleeping well, we under stress, all of these lifestyle factors has an impact. So if we can modify those factors, we can do a lot of good for our own personal health. And so we're going to talk about, of course, the diet aspect of it. In fact, over the last 20, 30 years, the Adventist Health Study Group, researchers right here on campus, but also world over, many research groups have shown that overall, eating a whole food plant-based diet can reduce the risk of lifestyle diseases. And when you look at this picture, you see a lot of whole grains, cereals, legumes, beans, nuts and seeds, vegetables and fruits, herbs and spices. And all of these foods, when we eat them on a frequent basis and make up our diet pattern, we tend to have a greater impact in reducing what we call the lifestyle diseases. And when we take a global tour on some of these plant-based diets, we look at the Mediterranean diet, for example, which is very popular in the media, but also from a research perspective. Many studies have been done on Mediterranean diet. This is not a plant-exclusive diet, but it is a plant-based diet. And one of the things that catches your attention is that every day, base each meal around these foods. And in that list, you see that with the vegetables and fruits and whole grains, you also have nuts represented. So not just eating nuts as a snack, but basing a meal around that, including that as part of a meal. That is a very powerful concept. When you look at the vegetarian food pyramid that was developed from the research of the Adventist Health Study, you notice that they recommend 1 to 2 servings of nuts per day. This is part of, again, a healthy diet approach. When we move on to the DASH diet that was recommended by the National Heart, Lung and Blood Institute for reducing hypertension, again, it's not an exclusive vegetarian diet, but a plant-based diet. And you notice here that 4 to 5 servings of nuts and seeds per week are recommended as part of a healthy diet. And finally, when you look at the MIND diet, this was developed by the Mayo Clinic, and this was a diet that was an extension of the DASH diet, and they were considering foods that one must eat frequently and foods that one must limit in order to decrease the burden of neurodegenerative diseases such as Alzheimer's and dementia. And again, what do you see in the frequently consumed food recommendations? You see nuts making a fine role there. So overall, when you look at all these vegetarian plant-based diet patterns, consistently what you see is that nuts is one of the main food groups represented in these diets. This association between nuts and reducing the risk of all-cause mortality as well as the disease risk overall started right here on Loma Linda University campus through the Adventist Health Study, and Dr. Sabate and his colleagues were pioneers in establishing that association. Over a period of time now, not only through the Adventist Health Study, but also various cohorts in the United States, but also globally, this has been replicated in various diet patterns. So it doesn't have to be only a vegetarian diet pattern. People eating Western style diet, but include nuts. People who eat a Mediterranean style diet that has nuts, they have seen consistently that association between eating nuts frequently and reducing all-cause mortality, but also some of the disease risk, especially ischemic heart disease and other chronic diseases. And since then, there has been, I would say, hundreds and hundreds of clinical trials that have been conducted both by our group, but others as well, that have looked at individual nuts like walnuts and pecans and pistachios and almonds, and looked at clinical trials where they bring in a group of people, intervene with a particular nut to look at what they do to risk factors for various lifestyle diseases. And that is the information I'm going to share in the second part of this presentation. So now let's dive deeper into the world of nuts. On this picture, you see a lot of variety of nuts that you're familiar with: pistachios, pecans, walnuts, pine nuts, almonds, macadamia. These are all called tree nuts because they grow on trees. That's simple definition. And they obviously have the same botanical classification because of that. But when someone says that I'm going to eat nuts, or what kind of nuts should I eat, what they're referring is not just the tree nuts, they're also including peanuts in that category. Now, peanuts are called groundnuts because they grow underground, and although they belong to the legume family, if you look at their nutritional composition and also their health benefits, they share the same thing with the tree nuts. So for the practical presentation purposes, but also in general for us in terms of understanding nuts in general, how they help, we can assume they are inclusive of both tree nuts and peanuts. Okay. So what I'm going to do is I'm going to now talk about what is it in these nuts that really give that potent health benefits. Now, when you look at a nut, a single nut, they are such a small package, right? They're a whole food. And even though they're small, sometimes they say great things come in small packages. That is so true for nuts. They have incredible amount of good stuff. If you take 1 ounce of nut, which is a serving of nut, they're actually very high in calories. A serving of nut can range from 200 to 350 calories. So one might say that's a lot of calories. Well, the other thing about nuts is they are a fatty food. Oh, wow, is that really good for us? Well, it's 70 to 80% of the nut energy comes from fats. But the good news is the fat that is in the nuts are called good fats. They are made up of what is called the monounsaturated fat, very similar to what you find in olive oil, which has been known to have good health benefits. The other thing is some nuts like walnuts especially has omega-3 fat, which is really good for the heart. So overall, even though it has a lot of fat, they are the good fats. Nuts also have protein. Now, some nuts more so than others. Almonds and peanuts especially have a lot of protein that are rich in a particular amino acid called arginine that can support blood vessel health or vascular health. Then nuts are good on fiber. Now, fiber, as you know, not only helps to prevent constipation, but is also a prebiotic for the good bacteria. So it helps with your gut health. Then nuts have vitamin E, which is a powerful antioxidant. And not only does it protect you from, oxidizing all that cholesterol and the fat in the blood, but it can prevent that oxidized fat from building up into those, fatty streaks that can potentially block your vessels. So it's very, very important antioxidant. Nuts also have other micronutrients like magnesium and selenium and B vitamins that are very good for overall the heart health, but also a variety of other health benefits. And one of the unique things about nuts is that it has a special compound called phytonutrients. Now, phytonutrients are various kinds. They are mainly found in plants, but the one that is very unique to the nuts or very commonly found in nuts are polyphenols. And polyphenols are powerful anti-inflammatory and antioxidant, and therefore they can bring down chronic inflammation in the body, which then can help to reduce the overall risk for many chronic diseases. So these are the things in nuts that work on their own, but interact with each other. And that is the power of a whole food. When you isolate them and take them out, you will lose that benefit. But being in a nut, they not only have their own things that they put their foot forward in a right direction, but together they bring out a lot of synergy, which also provides a lot of health benefits. So I'm going to share about those health benefits in the next segment, and I'm going to stop here for a few minutes.
Thank you, Dr. Rajaram. That is fantastic. We're getting some really great questions, and I want to remind our audience that if you have any questions and you're watching us live today, absolutely type them in the comment section, and we will ask Dr. Rajaram live here. So we have a couple of very, what would you say, practical questions for life that have come through, Dr. Rajaram. So here are the first question. Are certain nuts better than others?
Yeah, so the nuts in general, what I shared, this is a great question, first of all. So the short answer is not really. They all are equally good. And so feel free to eat a variety. Having said that, from the research perspective, we have studied certain nuts more so than others, probably because they are more popularly consumed in the general public. And so the interest is there. And so we want to answer to that interest. So when you look at the evidence base, there is a lot of research on things like walnuts, almonds, pecans, pistachios, peanuts. and more so on macadamia coming up more in the recent years. And these nuts, they definitely have a lot more of the good things I talked about. Now, all of the nuts have fairly a little bit of all of what I shared, but these ones that I just mentioned have a lot more of the good stuff in them. So you want to have a greater representation of these nuts. And of all the nuts, one nut that is a little bit unique is walnuts, primarily because they are the one of them that has the omega-3 fat, which other nuts don't share. Therefore, in your choice of nuts, you definitely want to also include walnuts. You don't want to only eat walnuts, but you also want to intentionally include walnuts. So that's what I would recommend.
Make sure they're in our regimen. Another question we have is, you talked about calories and you talked about fat. So the question here is, should I avoid nuts if I'm trying to lose weight?
It's a great question, and I will be addressing that directly in my second part of the segment, because as we talk about the healthy aging, we are also going to be considering weight, which is on everybody's mind, not just people who are growing older, even nowadays, even the young adults. So I would definitely be addressing that. But in general, the quick answer right now is that no, there is no concern with weight gain by eating nuts. And I share a little bit about in what context that I'm saying this, and clarify that for you in the second part.
Okay, we'll try to get to two more questions here. Keep your questions coming. The question I have here is, are raw nuts better than roasted nuts? And I'm sure, we all go to the grocery store, you have salted nuts, there's flavored nuts, all kinds of things. What are the kinds of things we should be eating?
Excellent. Towards the end of the presentation, I had a sort of recommendation, but in general, the more popular way people consume nuts is either raw or roasted. Either one is fine. Now, the salt part is really something that you can avoid if you can, because salt is not really, doesn't contribute to any health effects. If anything, it might be detrimental. We already have plenty of salt coming from a variety of other things we consume. So once in a while, if you have to eat salted nuts because it's tasty or you like it that way, that's fine. But don't make that your usual diet pattern. Preference would be to the raw and roasted. Now, the roasting itself, dry roasting especially, doesn't destroy any of the nutrients. You will have the same nutrients as you have in the raw nuts. So go for dry roasting if you prefer that little bit of that flavor. However, when you add oil and then roast, sometimes they do that. That added oil may not be a nut oil. It could be something else, like it could be a corn oil or canola oil or something else. And so it takes away from that. You're adding now calories that are just empty calories, which you could, abstain from, because already you're eating a nutty food. Why add another fat to it and destroy it? So for practical reason, I would say raw, roasted, especially dry roasted.
Okay, perfect. And the last question also has to do with oils. So the question here is, how about nut oils? And I know a lot of people fry in like peanut oil just because the smoke point is high. Are those oils okay to use?
Excellent. Again, nut oils definitely are good to use. Again, you have to consider the fact that it is not a whole food. By the time you extract the oil, you definitely have eliminated fiber. You have eliminated some other things like polyphenols, which I talked about. So the oil that you have is just mostly the fat content. So as a fat, yes, the monounsaturated and omega-3 rich oils are better than your omega-6 oils or other types of saturated fat oils. However, compared an oil to a whole food, you will miss a lot of the valuable food. So if you are using for salad dressing or for even sauteing, you can definitely use a little bit of instead of some other oil that you might use, you can choose to use this oil. But one of the things I would say here is that the extra virgin olive oil that people sometimes use, where it's for, just like for a salad dressing, those still retain a lot of the polyphenols. So it might still be a better oil to choose from. Whereas when you use walnut oil or peanut oil, they are stripped of those compounds. So you can use it definitely as if you are in the process of using it for some purposes like salad oil or other things, use it. But don't use it as a way of consuming your nuts. Don't say, I had nut oil today, so no more nuts for me. That would not be a good option to consider.
Perfect. Well, thank you so much. And to our audience, why don't you keep your questions coming? We have another question and answer with Dr. Rajaram coming up soon. And why don't we get to the second half of your presentation?
Very good. So let me go back to my sharing the screen here. All right. So we are going to talk about the various role nuts have with having a healthier heart, for healthy aging. And the first one we're going to talk about is the healthier heart. Now, right here at Loma University, a group of researchers, we were looking at a 2-year clinical trial where we brought in about 700 healthy elders. And these were 2 cohorts, one from Loma Linda, another one from Barcelona, Spain. So obviously they were eating 2 very, very different diet patterns. And the intervention was that one half of the subjects would eat walnuts for 2 years every day, and the other group would abstain from eating walnuts for 2 years. And we looked at a variety of aging parameters, but one of the outcomes that we were interested in, we published recently in a very prestigious journal called Circulation, is a study that basically showed us that when elders eat walnuts every day, it actually lowers the bad cholesterol, which we call LDL cholesterol. Not only that, that has been shown a few years ago from other studies too. But what was also very interesting was that the overall tendency was for the atherogenic potential to be reduced. Now, what is atherogenic potential? You heard of atherosclerosis, where you're building up this fatty streak and it blocks your heart, right? Gives a heart attack. Now, that comes from actually the cholesterol building up and getting oxidized. And if you can prevent that from happening and you can change that potential, then you're reducing that atherogenic burden. So that in essence helps to reduce your cardiovascular disease risk. And that is what we were able to show the walnuts does when healthy elders ate it for 2 years. And not only us, but many others around the globe have shown that different nuts, walnuts, almonds, and pistachios, they lower not only blood lipids, especially they lower the bad cholesterol, but they improve your overall vascular function. That means your blood vessel health is improved. They reduce blood pressure and also the buildup of this fatty streak that I talked about. So this is a very powerful study that was published a few years ago. Now, recently, the Harvard group researchers published in another prestigious journal, the Journal of the American Heart Association, that when women and men, the older adults, they consume nuts frequently, they actually start to see a decrease in cardiovascular disease risk and stroke risk. And this can happen within a short period of time, which is about 4 years. So that means it doesn't take much time to see significant differences. And so it's never too late to start. So if somebody says, I'm already older, I have not been eating nuts, will it even make a difference? Yes, it will. Even if you start now, in the next 5-10 years, you can, even 4 or 5 years, you can start seeing significant reduction in the risk of cardiovascular disease risk and stroke risk. And for those that reduce the consumption, and they have noticed the opposite, that the risk actually goes up. This is very powerful because that means a single food, like nuts in this case, can make a difference. Even if you eat a vegetarian diet or a Western diet, Mediterranean diet, doesn't matter. Just adding the nuts can make a difference in overall reduction in the risk of cardiovascular disease and stroke risk. The second health benefits as a person grows older is, having a sharper mind. And, the age-related cognitive decline is actually also on the grow. And a lot of people say that the prevalence of dementia and Alzheimer's is on the rise because the aging population is on the rise. Now, we also, in the similar study that I just shared about, we also looked at whether walnuts is good for the brain. And we also published this recently in a top nutrition journal. And in the same 700 elders, we took a subset of them and we also subject them to what is called a functional MRI, which is like a magnetic imaging that we do. But at the same time, we allow them to do some kind of a brain activity, and we are capturing that in signals in their brain. And what we noticed was that people who ate walnuts and also had a very high risk for cognitive decline. Maybe they had lower education status, they had poor economic status. There are many risk factors for age-related cognitive decline. When we considered people with a higher risk, in those individuals, eating walnuts for 2 years lowered the or delayed the cognitive decline and also improved the overall cognitive score. So there was a positive result with eating walnuts for cognition. Now, Others have also noticed that when different nuts are eaten frequently over a long period of time, it is associated with a decrease in cognitive decline, but improved cognitive function. This one study was published in older women, which showed that when women ate 5 servings of nuts a week, they tended to have improved cognitive scores compared to groups of women that were matched for everything else, but that ate very little nuts or less than 1 serving of nuts a week. So just nuts has that independent effect on improving cognitive function. The third health benefits that you see as a person grows older is that nuts can help safeguard your eye health. Now, along with age-related cognitive decline, there is also something called age-related macular degeneration. Now, macula is in the center of your retina of the eye, and it is the one that allows you to see a sharp, focused image. And so when people have macular degeneration, they have that blurry, fuzzy image that they start seeing. And what we have seen is that the same nutrients that are there in the nuts that help with cognition, that help with the heart health, also benefits and preserves the macula and supports the macular health. In fact, the evidence base is still on the grow in this particular topic. There is not as many research that has been published on macular degeneration with nuts as much as for cognition or for even heart health. However, the preliminary evidence is beginning to show that it is very same in that individuals, especially women again, who ate 4 servings of peanuts a week had lower risk of age-related macular degeneration than women that did not eat peanuts at all. So this study was on peanuts, but there have been other studies that have been done. But as I said, the evidence base is on the grow right now. But it is pretty similar to what we saw in trends with cognition and for heart risk. The fourth health benefits that you see is maintaining blood sugar control. Again, the risk of diabetes and poor glycemic control is on the rise, and with aging that also grows. And this is a meta-analysis that was done, which really looks at the various different clinical trials that has been conducted over a period of 2-3 decades and put it all together to make sense of the data. And what we know from this is that when you consume 2 ounces of tree nuts, it can significantly lower your glycosylated hemoglobin, or what we call hemoglobin A1C, which indicates how well your blood sugar is regulated. If your hemoglobin A1C is very high, then you have very poor glycemic control. And when you have lowering of that, that indicates that you have better glycemic control. And also your fasting glucose is lowered with 2 ounces of tree nuts a day. And this is in a span of about 3 to 6 months of intervention. Also, when diabetics include tree nuts in their daily diet, they maintain a better glycemic control when they do not include nuts in their diet. So this is a good evidence that for diabetics and for people who have a family history of diabetes, it would be worthy to consider nuts as part of the daily diet. The next thing that you want to think about as you grow older is the people that talk about, oh, pain in the joints, aching joints, and nuts have been shown to ease those aching joints. In fact, the reason for these kind of arthritic pain and joint pain is what we call as inflammation. Inflammation, the chronic inflammation, can increase the risk for these arthritic and other joint pain, but also chronic diseases. And in a recent study, it was shown that people who consume nuts frequently have a lower level of inflammatory biomarkers in their blood. And in fact, there are foods that are considered anti-inflammatory and foods that are considered as pro-inflammatory. And as you can see here, nuts are part of the anti-inflammatory foods. In fact, the Arthritic Foundation, they have a sort of a note there that says that nuts and seeds may come in small packages, but they have a lot of big benefits for people that have arthritis. So it supports reducing pain because it reduces inflammation. Now, finally, getting to the point where a lot of you have concerns is that when I eat all these nuts for other health benefits, what about my body weight? With all that fat, would I gain body weight? Well, let me tell you, one of the 6 health benefits that has been shown with eating nuts is it prevents or mitigates age-related weight gain. In fact, the tagline is extend your lifeline without expanding your waistline. And that is what nuts can do for you. Studies have shown that tree nuts may play a role both in weight loss and weight maintenance. And in fact, the whole concept of whether nuts will help you, will make you gain weight, we observed through a variety of clinical trials where we were feeding nuts for various studies for 12 weeks, 6 months, even 2 years. And we noticed that even after all that of nuts that people ate, they never gained weight. And we were intrigued by that. And along with our group and other researchers, it has been now shown that nuts, even though they have a lot of calories, much of those calories never get into our body because some of it is excreted in your stools as fat intact in those nut granules. That is the power of eating whole foods, because they are in the matrix of the nuts that doesn't even get absorbed. So they end up in the stools, which is good for you because you've taken all the good part, and that extra calories that you don't want, you've flushed it off, right? And so we have 3 things that I want you to remember. When you take somebody who's already on a weight loss diet and you add nuts to their diet, you will produce better outcomes. Along with the weight loss, you will have better outcomes in terms of decreasing waist circumference, decreasing body fat when they have nuts compared to when they are on a weight loss diet that does not have nuts. So nuts can be very important as part of a weight loss diet. Number 2, for people that are already normal weight and they just want to maintain the normal weight, adding nuts will help them do that effectively, right? And the third thing, which is the most important question, if somebody is already overweight or obese and now they're starting to eat nuts, will they just get worse? Will they just add more weight? Will they increase their waist circumference? And the answer is no, because we have done many studies on overweight, obese individuals where they've had to add nuts to their diet, and we didn't give them any advice on whether they should replace something else. And what we observed was people automatically displace other foods because nuts can improve satiety, which means when you eat nuts, you tend to feel fuller longer. So your ability, you tend to reduce the intake of other foods over a period of time, which automatically reduces the caloric intake and allows you to lose weight. So nuts can be useful part of diet for anybody wanting to lose weight, wants to maintain weight, or even if you're overweight and obese and you don't want to get worse, but you want to improve other parameters, you can still consider nuts as part of your diet. If you're overweight and obese and you are not really on a weight loss diet, but you switch use nuts to switch off some other snacks like potato chips or some other carbohydrate snack, you can actually start losing weight even without changing the overall caloric intake, because you've replaced empty calories with something which is more potently filled with nutrients. So in summary, when you look at all the different types of sources we consume nuts, we have the raw and roasted nuts, and mostly unsalted is what I would recommend, but some people eat salted. Then people eat nut butters. That's a very common way of consuming nuts, and nut flours that can be used for baking and other things. So you want to include at least 5 to 6 times a week nuts as part of your diet. I would say, what is a big deal giving yourself a day off? Go for it. All 7 days, enjoy nuts. A serving of nuts is 1 ounce, a fistful of nuts. And use a variety of nuts, nut butters, nut flour, so you have a lot of varieties. But as I said, among the nut choices you make sure that you intentionally include walnuts, because they do have that omega-3s. And there's a lot of ways you can add nuts. It can be added to salad, cereal bowls, oatmeal. Use it as a snack, make a smoothie, top it off on your pizza or your pasta bowl. But it allows for that crunch, the flavor, the nutrition, the health benefits. It is just overall a superfood, in my opinion. One of the interesting things I want to leave you with is that there was a global burden of disease study that was published, which includes 100,000 data sources, over 300 institutions, over 50 countries, where they want to simply look at what happens if, in a public health perspective, we allowed more people to add one particular food to their diet, how many lives can we save? And what they found was that when you add nuts and seeds, when more people eat nuts and seeds, 2.5 million lives can be saved. That is a dramatic number for one single food that you simply add to a diet. Okay. And so in conclusion, make smart food choices for healthy aging. It is never too late to make smart food choices. Make sure that nuts are part of your usual diet, whatever it may be. And it is definitely worth getting nuts about healthy aging. So I enjoyed talking with you, and I can answer more questions.
Wonderful. Thank you, Dr. Rajaram. That was fantastic. We have a couple questions. We have time for maybe just one or two questions here. The first question we have is, I have high cholesterol. Do I have to worry about how much nuts I consume?
Excellent question. In fact, one of the best things you can do when you have high cholesterol is to include nuts in your diet, because nuts, as I said, not just with walnuts, which I showed you earlier, with other nuts as well, we have done studies on people that are hypercholesterolemics, or people that have high cholesterol levels. And we have shown that, in fact, that when you have high cholesterol, your body even does better with the nuts, in that you have a even more significant drop in your cholesterol when you include nuts. So when you consume nuts, when you have high cholesterol, you can include 1 to 2 ounces of nuts per day and not worry about it, because it's only going to reduce your cholesterol, not exaggerate it.
Okay. This is more of a general question that probably includes nuts in there. Is, if someone has chronic disease, is it advisable for the individual to practice being vegetarian? If yes, how is it going to help the individual?
Very good. So on a individual one-on-one level, the answer is yes. So obviously, we have shown that vegetarian diets, that is a plant-based diets, are helpful. But it is not that just the term vegetarian makes a diet healthy. It is the intentional inclusion of whole food-based plant foods, right? So there's a big difference there, because a lot of times people who are not sure about how to go about becoming a vegetarian, they might think that just abstaining from eating animal foods is, you become a vegetarian. To some extent, that is a good start, but that is not all of it, because you could eat potato chips, for example. You're a vegetarian, because really potatoes are vegetable, right? But the problem is, you could be eating a lot of refined foods. So there's a lot more to the word vegetarian and plant-based than just saying that, and just switching that makes a healthy choice. So what I would suggest is, first is, if you have a chronic disease, obviously you are working with a physician, a health provider, to go over what is necessary to start the intervention medically, as well as overall lifestyle habits wise. But when you decide on a diet plan, obviously choosing to go with a whole food based, plant-based approach is where you want to start. And you want to sit with somebody who's, again, a qualified professional like a dietitian, that can walk you through how you can do that, because it's not easy as just switching, as I said, stop eating something. You want to intentionally also focus on what should I eat to get the maximum benefits. So yeah, so that's the kind of answer I would response that I would give.
Perfect. Thank you so much, Dr. Rajaram, for your time today. I know your time is in high demand and you spent time with us today. And on behalf of myself and our team and the audience, thank you again for all of this information. So just as a summary, we have learned that it is never too late to start eating nuts. We need a handful of nuts. It is good for diabetics, for heart patients, and basically, if you want to live a long, healthy life, nuts are a good thing to incorporate into our diet, maybe every day. Well, with that being said, I want to thank you all for joining us, and you won't want to miss next month's session. So if you're interested in lifestyle and how we talked about it today, you are not going to want to miss it, because it is talking about a high dose lifestyle change. So for example, if you are on medication, maybe you are on a high dose. What happens if you do lifestyle changes in high doses, and how that actually can help you get your disease into remission? So you don't want to miss that. That is on June 30, and it will be Dr. Sylvia Kramer will be talking to us about that. Well, thank you again. I hope you enjoyed our session today. My name is Dr. Olivia Moses, and we'll see you next time.